Hey everybody, it's Jess DaMassa with What's the Future Health? I am talking to the who's who of health technology and healthcare innovation. And today we are diving deep into telehealth. We are catching up with Roy Schoenberg, the co-CEO and president of Amwell, J.D. Power and Associates, #1 consumer telehealth company. Roy, it's so good to have you here again. Thank you for coming by.
Delighted to be with you, Jessica.
Roy, I went back and looked at our last interview, and it's like, I feel like this was like a time warp that has happened. It was pre-IPO. It was before the Teladoc Livongo merger. It was in the middle of the pandemic, in the middle of the summer. It's before you had a son. I mean, there's like all sorts of things that have happened since then. So let's dive right in and just catch up. So tell me how the IPO went and how things are going right now in the middle of like the biggest year of telehealth, right?
Yeah, I mean, it's funny. We've been around for 15 years. You know, we started Amwell 15 years ago. So I can certainly say that this was kind of walking the desert for a long period of time, trying to persuade people that telehealth is not going to kill everybody and you can deliver safe healthcare over technology. Don't worry, it will be okay. But it did take 15 years. And definitely, even though we had nothing to do with bringing, God forbid, COVID, COVID kind of helped illuminate to everybody the power that telehealth brings to the table and the notion of digital healthcare altogether. And we took the company public end of September, I think it was. And I must say that it went well.
Good.
Yep. You know, we kind of knew that telehealth was definitely a technology that people believed in. As you know, when you go public, it's not only individuals. The market has a lot of different instruments in terms of going public, and it was in unison. I mean, I can't describe it otherwise. That we've seen everybody that we wanted to see participate in the IPO did. And it gave us a great springboard in terms of the company's liquidity and operation to do what we think is coming, which is a lot. So perfect timing.
It is perfect timing. I can't wait to dive into this. The last time we spoke, we were talking so much about infrastructure and telehealth becoming the infrastructure and just being the conduit between the consumers and healthcare delivery and really playing more of a role as a switchboard. And so I want to come back on that with you and kind of pick your brain about your strategy. But before we do that, a couple big partnerships I want to talk about real quick. Tell me about Google.
Yeah, so it was interesting. So right around the IPO, we announced a very deep partnership with Google, where Google selected Amwell to be its telehealth infrastructure worldwide. And we love Google anyway, so we didn't have to confess our love there. But I think it's a powerful partnership because it really speaks to that role that you just mentioned. When we talk about telehealth, not as a product to get a Z-pak, but really as an infrastructure for digital distribution of healthcare, it goes much, much deeper into the understanding of what role it will play when people have longitudinal needs, when they have a chronic condition or they live with cancer or they're elders and they're at home and it's hard for them to come out. What are the other things that we need to do? And kind of the broader view of telehealth is that whatever that mantle that we can wrap around these people that need a lot of healthcare is going to be a combination of a lot of synchronous telehealth, which is kind of the core competency of Amwell, but a lot of other things will have to come into play. Data, services, natural language processing interaction, AI interaction, a variety of other tools that are in that kind of treasure box of Google technologies. And I think that was kind of the driver behind the decision to partner, because that is where the future is going. So we equipped ourselves, and hopefully we helped Google equip themselves with future-looking technologies.
Can you say a little bit more about what we might be expecting to come out of that partnership? Can you get into it at all?
Well, I think certain things are obvious, right? I mean, there's a lot of Google capabilities that anybody that's a little bit kind of curious about technology knows, in terms of things like listening to conversations and creating translation out of them and transcribing out of them and so on. There are very innovative solutions that we are all aware of, like Google Maps and others, that have a role, can actually play very, very inventive roles in the way that the clinician and the patient are interacting, and the physician or the clinician helps the patient orchestrate care. But then there are deeper and deeper capabilities. Natural machine learning and natural language processing are fascinating in the sense that they begin to take a little bit of the lift of all the touch points that we need to have with patients regularly in order to check up on them. And the problem with, it's not an Amwell reality, it's everybody's reality, that checking up on patients and checkpoints with patients are incredibly expensive transactions, especially in the US. So if we can begin to balance the load, if we can begin to say, if we are there to be multiple times a day touching a patient and so on, and some of those interactions can be very informed, very accurate, but carried out automatically by those kind of infrastructures, we're going to better inform the patient, we're going to better inform the physician, and we're going to make sure that care happens at the right time and be there for the patients all the time. And these are a little bit down the line, but we strongly believe that that is what we owe the American people.
I love that. Oh, we're owed that. I love it. I want to ask too about the other big deal that was just recently announced in January with United Healthcare, because I think that this one was, a bit of a surprise in the sense that it was just when it was announced, the timing of it right around the beginning of the year. Virtual primary care, though, that was no surprise, because I feel like that has been just an area of just intense focus, that whole idea of the digital front door. Can you say anything about the United Healthcare partnership? How's that going so far? You guys are rolled out in 11 states. I looked on your site, 75 million covered lives that have access now to Amwell. I mean, like, to me, that's like, these numbers are staggering compared to where we were like a year ago.
Yeah, so I think that we actually had a relationship with United and with Optum for a long period of time in a lot of different telehealth instruments, and members of United always could get Amwell services. It was a covered service. I think that what was announced in January, and I want to be very careful, I'm not speaking for United, I'm speaking for Amwell, and we supported them in terms of technology and services in this virtual primary care rollout. I think it's the recognition that, actually it's tied to the conversation we had in July. It's the understanding that telehealth has a much bigger role to play than just carrying out transactions. Mm-hmm. It's interesting to me as an elder telehealther or something, I don't know, whatever it's called, 15 years ago, where I used to go in front of medical boards and try to convince them that if all else fails and the patient doesn't have any other option, okay, you should use telehealth, because not getting you care couldn't possibly be better than giving you telehealth. That was kind of the starting point all these years ago. That was the only way that they would allow that. And there we are, with virtual primary care, where, there is the understanding that maybe this is where relationships between physicians and patients should live. Maybe that is the place where, it's convenient. It's a way we're connecting patients with live clinicians who are acting as primary care clinicians for those patients. That's a very big difference than transactional urgent care telehealth. But the notion that, there's a world of people who prefer to do everything through their phone anyway. Some of them do their relationships over the phone. I mean, not sanctioning this in any way, but that's the reality. That may also have a captive audience in healthcare as well. There are so many people out there, for a variety of reasons, who don't have a primary care physician. Some of them, it's because of the inconvenience associated with it. Some of it because it's really hard in certain places to find a primary care physician with an open panel. And some because they think they're invincible and it will never happen to them. And all of these folks at the end of the day end up getting compromised healthcare because they go to emergency rooms to get their healthcare, which is, if you have a car accident, that's where you need to end up, not if you have the flu. So the understanding that telehealth can actually become another gateway for appropriate healthcare for people that are of the digital age, that feel comfortable with the technology, that love the idea that they can interact with their PCP immediately. It's almost like, concierge practice is no longer the privilege of the affluent and rich and famous. Concierge practice, in some ways, that accessibility, that convenience can now be made available through technology to a much broader population. So, in my mind, it is a major turning point. This is not a trivial thing. It's a big deal, the arrival of virtual primary care. And I think we are just beginning to scrape the, kind of the surface on what happens when it is possible for a patient to have meaningful healthcare relationship through technology. I think that is, by the way, that ties to the conversation we had about Google technologies and everything else.
Yeah.
Pretty much kind of see how all of this comes together.
I do. I want to ask you about clinicians, because this was something we spent quite a bit of time talking about last time I spoke with you. And you had said, we cannot do anything unless we win over the clinicians. And I'm just curious to hear how you think that's going. And in light of what you just said as well, about this whole idea of now it's like telehealth in some ways is democratizing the boutique, concierge medical service, because you have the ability to call a doctor on your phone. And I think, along with how clinicians have been, I guess, brought along through the pandemic, when you and I spoke in the summer, it was out of dire necessity to keep their practices going. They needed to stand up telehealth services, and it was panic mode. Now we're in a very different place. What's going on? I mean, give us like a state of play on the state of clinicians' minds as far as telehealth goes. Do you feel like they've just kind of seen the light as far as like what you've said from the 15 years ago begging, and instead of nothing, telehealth is better, and now it's like I'm rebuilding my whole practice around this? Like,
listen, I can probably pick up big words and come up with long sentences and everything, but you nailed it on the head. That's exactly. I think people experienced it, and they love it, and that's it. It's almost like, in some ways, and I'm not suggesting for a second that healthcare is simple and easy or is the same thing as retail, but it's all of the skeptics who didn't think that they can buy shoes online because you have to wiggle your toes, you have to do all of that kind of stuff. I mean, how could you possibly buy shoes online? That's the furthest away from something that you would. And then people bought it once and they tried it on, and if they didn't like it, they returned it, got something else the next day. And that's how most shoes are being sold, right? So, and again, I want to clarify, I'm not suggesting that healthcare is like buying shoes or trying shoes on, but the liberation that comes by allowing those interactions to be fluid, by allowing those interactions to be very intimate, by allowing them to not be burdened by all of the administrative, red tape that surrounds scheduling office visits and doing all of that kind of stuff. The value of that is real. And I think it's not, a lot of people think about, when they think about, things like the triple aim, and I hate those terms and so on, but when people think about putting telehealth into a bucket, they think about excess. Why? Because if you are in North Dakota and it's snowing and whatever it is, you can still see a physician and get a Z-pak. So everybody's view of telehealth is excess. In my mind, it's actually the quality of healthcare that we can imagine for ourselves is dramatically different with telehealth, because we can get in front of the right people. We can get in front of them at the right time. We can see them as frequently as we need to. We can have the right data show up in front of the clinician rather than having them, look at the books or whatever it is and find those kind of things. We can create collaboration opportunities between my primary care physician and an oncologist somewhere to help cater for the regimen that I need to go to. All of these elements, at the end of the day, affect the quality and experience of healthcare that we can learn to expect as people. And I think that's the turning point that happened in COVID, where people understood this isn't just an excess technology. It's a way for us to reimagine healthcare experience altogether. And virtual primary care is an example of it. And a couple of other things that are coming are all examples of that transformation.
Can you give us an update on what's going on from a regulation standpoint in terms of, state licensing and things like that, and the payment at parity for virtual visit and in-person visit? What are you hearing in your role as co-CEO of one of the biggest telehealth companies out there about what's going to happen next after this? Because that was really, at the time that we last spoke, that was the thing on everybody's mind is what's going to happen with these regulations? Are they going to change them back? What's it going to do to the business? So what are you hearing? Give us a little bit of gossip.
Well, gossip. I don't speak for the government or the administration. But the general sentiment is that, you know, the biggest concern that we had in July, that all of these kind of variations or exemptions that were part of the COVID, you know, early days, that people were concerned they don't want to change their business if they're going to go away in a month. You know, why even bother? So the good news is that they're not going away. The majority of them are here to stay, and I think that was already part of the you know, Verma was speaking and so on. You know, in the previous administration, that's also happening in the new administration. It is here to stay. So if you're a clinician, if you're a health system, and you're beginning to put yourself into a position to do your stuff through telehealth, you are probably going to get rewarded by it, and it's going to be here to stay. It's expanding also in terms of modalities. There is better understanding on how that translates into chronic patient care, into longitudinal care. These are, you know, things that may be boring to hear about, but they are so fundamental. The notion that we are no longer looking at the home as an illegitimate place of care, the fact that we're transitioning and we're accepting that the home can be a point of care, is drama in every sense. And I don't mean it only by the way of, yeah, the claim is going to get paid. It sends a message to the market. Let's build solutions for the home. Let's build devices for the home. Let's start thinking of sensors differently. Let's start thinking about the television differently. Let's start thinking about, you know, local support differently, and so on. So I think that this is, you know, it may sound like, oh yeah, this code is going to be covered by Medicare. It's a much, much deeper, you know, understanding that is dawning on the market, that this is the new norm. This is the new reality. The other thing, however, that you briefly mentioned, and in my mind is going to be the, you know, there's always a little bit of drama. It's kind of nice. It kind of gets the blood to flow. I think the next war zone, the next kind of place where there's going to be a lot of heated confrontations and conversations, is the state licensure. Because we're still in a world that, you know, everybody's like, well, you know, it's a statutory thing. It's this. It cannot be federated, and, you know, medical boards are per state and so on. But we can't escape the understanding that if we can utilize telehealth as a way to pool resources together, to pool knowledge together, to create collaborations between rural areas and metropolitan areas, to allow availability of neurologists from one side of the country affect how you deal with the telestroke in West Texas. There are things that are just no longer deniable, and they are in conflict with state licensure. So I think we are heading into a battle there. I think that I have some idea as to who's going to win the battle.
Oh.
And I think, I mean, this isn't a medical thing. I think the value to the people by opening up healthcare so that it can flow freely around the country is so experiential. We will, the moment that that limitation is removed, we will the next day have a different kind of healthcare experience as Americans. It's rare that such a small regulatory change can make such a deep impact on something that we all really, really care about. But I think this is the war of 2021, state licensure.
Yeah, and thank you for putting it that way. And I think you beautifully outlined the benefit of eliminating that state licensure requirement, because I think it is a matter of just, you know, the quality of life impact on all Americans of being able to have access to the right kind of physician, no matter where they're located, is really important. So what's next for Amwell? What do you have your sights set on in all of this? I've heard you talk about, you know, the technology partnership with Google and some of the like very sexy, cool things that are, you know, going to be folded in there. You've got this partnership with United, which, you know, it is looking at virtual primary care, your own model. It's like, to hear you talk about it, like, my big takeaway from the last time I spoke with you was that you guys are like more of an infrastructure play. Like I know you have the medical group, but it's really more about being like that conduit and being the switchboard and having, you know, the quality piping that's laid underneath all of this. But what do you say? I mean, what is on deck for you in terms of scaling up and, you know, really taking advantage of the opportunity here after 15 long years of working so hard for it?
Yeah, but you know, it's a labor of love. I don't mind doing it. It's like, and it's so wonderful to see that you know the value is being captured and everything else.
Yeah, I mean, but that's exciting because it's like what you like finally is like you can say like,
Yeah, it's very
see,
real.
I told you. And so now
Yeah.
like top of the
How
world,
often
like
do you
what
get
are
to
we
do
doing?
that? That's right. No,
What are we
you know,
spending
it's,
some of the funding on, you know, like what's going on over there?
you know, I think it's the we have the opportunity to realize all of those things that we talked about and preached about are now upon us to realize as the barriers go away, as the perception, as the adoption goes away. But I actually want to come back to the very first thing that we said 15 years ago that I think is still true. We want to allow patients to be patients. We want to respect and allow clinicians to be clinicians and practice their art. We want to give them a technology foundation to do that, which means that our job isn't to, you know, create another kind of healthcare system, a shadowy healthcare system that runs over the internet like the Matrix or something like that. Our job is to put the tools in place, make the connections, and step back and let people do the right thing. And I think we're closer to that today than we've ever been. So that puts a chip on our shoulder because there are no excuses now, right? This can, you know, there's business schools that talk about blue ocean, red ocean theories and all that kind of stuff. We're in blue ocean world now. So we have a chip on our shoulder in realizing all that this can offer. And it's fascinating. It's amazing to be at this point in time.
Okay. Blue ocean, I want to ask you just real quick. I mean, you got a couple other sharks swimming around you. You know, there's that whole Telehealth from hospital to home thing being built. There's UpHealth, that 6-company digital health super company. They're saying they're going for an infrastructure play. What do you think of the competitive landscape, even though it's a blue ocean?
Yeah, you know, blue ocean doesn't mean that there's no
right.
competition out there. And I think, and by the way, if there was no competition, I would be worried. It means that it's not real. I think that is an indication of the fact that this is a very healthy, very promising, very viable market, and that's great. You know, there's a lot of stuff that Teladoc is doing that I think is fantastic, as do many other companies. I think that the distinction that you made is right on the mark. We are an infrastructure company. We're a technology infrastructure company that allows the traditional players of healthcare to transition into using digital platform to do their job. There are other companies, I'm not naming one or the other, that create products. And those products are, you know, popular. Those products deliver, you know, value in what they do. But we strongly believe at the end of the day that the products are the world of clinicians and hospitals and health systems and payers and the government, by the way, and Medicare, Medicaid that are out there. They are the products and they're the way healthcare is delivered. And if we mobilize that, then we don't have an app for Z-pak. We become the switchboard on which healthcare happens. And I can tell you that when you think about the competitive landscape, all of those newcomers who are flooding into the market with a product for this and a product for that, maybe the one observation that I would make is, if you don't build your services to accommodate how healthcare actually works, but rather throw something in and say, I will build it, it will be great, and then they will come, you don't understand how healthcare works.
Yeah, it's pretty nuanced, right, Roy?
I'm saying this is a good thing, not as a bad thing, because if you take that into account, then maybe you'll navigate, you know, that kind of stuff. And it's an observation. I'm not saying it's true for everybody, but, you know,
well,
that's
I mean,
something we've seen.
That's a well-evidenced observation, I would say. I feel like you've got a particular area of expertise in this space. It's been fun to watch it unfold. And I mean, especially these last the last year of this with, I mean, not just in telehealth, but in all of the adjacent virtual care services like digital health and things like that, just to watch all, I mean, the market put a lot of big bets on a lot of different companies to provide different kinds of care. It has been very interesting. For you guys looking ahead, you said to me that the thing that the fight that you think we're going to have this year is about state licensure. But what do you think the big opportunity is going to be this year? You know, as the vaccine is rolled out, as COVID starts to, you know, become less of a limitation on the way that we, you know, as people, as patients experience, you know, our lives and healthcare and things like that. I mean, what has you most excited, I guess, looking forward into 2021, 2022? Because I mean, there's going to be, you know, fallout from everything that has happened, but there's also, you know, in that chaos comes great opportunity, right?
Yeah, I think that, you know, maybe the best way for me to describe it is, I think we have an opportunity for partnership. Not in that sense of partnership with another company or whatever it is, but partner with patients differently, in the sense that we can bring in sufficient value to become a regular companion for those patients, especially those that have repeat material healthcare needs. We talked about access versus quality, you know, all of these new lenses by which telehealth is considered. I think most people consider telehealth as a transactional platform. If I'm the patient and you're the physician and I see you, yay, we're done. You know, that's telehealth right there.
Yeah.
And I think the transition and the greatest opportunity is whether telehealth and a couple of other capabilities associated with it can actually be a regular daily companion with patients, not only when they are interacting with a clinician, but through the day, through the night, through the next day, through the weekend, as they, you know, struggle with cancer, as they deal with heart failure, as they deal with asthma, as they have long-term healthcare needs. Can these bag of digital technologies that include synchronous telehealth become part of the invaluable things that they have on their phone that allows them to live longer, be healthier, be more reassured, be more comfortable staying in their home rather than go to a skilled nursing facility or anything like that? That's the opportunity that's in front of us. And that's, to me, that's drama, because that is where I hope that when I'm old, I hope my life is going to look that way.
Yeah, instead of the right care at the right time in the right place, it's all the care
Schlepping
at any
myself to
time,
wherever
any
healthcare
place.
is.
Yeah, forget it. Yeah, and being able to
Surround
have
me with healthcare.
Mhm.
Yeah.
No, I think that's surround me with healthcare. I love it, Roy.
Yeah.
I love that. All right. Well, thank you so much for giving us an update on where things are headed for Amwell, and also for just talking more broadly about the bigger issues that I think are facing telehealth and virtual care and digital health this coming year. I really appreciate that. And I love the position that you've taken, is that this is a quality play, not an access play. I mean, I'm going to be thinking about that now for like the next couple of days, because I think you're right. It's like, what comes first? Isn't access a part of quality? You're going to send me down a rabbit hole here, Roy. I love it.
Yeah, well, I guess that's why you have me here, right?
That's why it is. You're like my philosopher. Like, it's the philosophy of
That's
healthcare, according to Roy Schoenberg. I love it.
My next career.
Next career. Well, thank you again. It's always a pleasure to speak with you. Like I said, you get my brain going in a very good way. And it's always nice to hear your perspective on where the industry is headed after watching it evolve for such a long period of time. So thank you.
Pleasure to be here, Jessica. Anytime.
Thank you. I'm Jess DaMassa. To check out more interviews with the leading thinkers, our philosophers out there, check out my WTF Health YouTube channel. That's youtube.com/WTF Health. We'll talk to you guys real soon. Roy Schoenberg, the co-CEO and president of Amwell, thank you so much for dropping by. Bye, guys. We'll talk to you later.
Thank you.